Hi, my name is Lori Bryant, and I just want to share with you what my husband and I have been through over the past year. If you have ever been diagnosed with cancer or someone that you love has been, you know how traumatic those words can be when they come from your doctor. Uh, we had gone on vacation about a month prior to going to the doctor, and my husband was complaining that he was having to use the restroom a lot and that he was having lower back pain. When we got home, we made an appointment with our family doctor, and at that point, they did a PSA test. The PSA read 75, and he recommended that we go see a urologist. So we chose one in Oklahoma City that was very well known, very good doctor, and we were pleased with him. He did a biopsy, which almost killed him, by the way. It wasn't the doctor's fault, it's just the evils of having a biopsy done. We found out later that it's not necessary to do that you can actually go have an ultrasound done. And it could save you and your family a lot of grief, a lot of stress, and possibly a funeral. I know that doctors like to do biopsies because they like to know where you are on the Gleason scale and what your outlook of recovery is. My husband was in the hospital already, trying to recover from the biopsy. He went septic, was in the hospital for 7 days. On the 6th day, the doctor came in and confirmed that my husband did have stage 4 prostate cancer, that it had spread to the bone in his hips. And as you can imagine, everything just kind of went to a blur after that, because you always think it can't happen to us. It's not gonna, nothing like that's ever going to happen to us. It can't be that. My back's just out. I just have a bladder infection. You come up with all kinds of ways to reason it. After our urologist left, his room just became a flurry of activity. We had all kinds of doctors and nurses in and out, social workers giving us information as fast as they could. We met with the floor doctor. We met with the radiation oncologist. We met with just a regular oncologist, all there local to the hospital. And while we were grateful to talk to these people, we were also told that if you had to pick a cancer, this was the best one you could have. I just want to say, baloney. There is no good cancer. And if you do your research, you find out very fast, once it moves out of the prostate, that your outlook is not so great. You probably have a 2 out of 100 people survive the first 2 years doing the standard of care. I'm going to share different videos with you and hope that we can save someone from going through just the horrors of the standard of care. And we just want to share with you that there are other options out there. My husband's chance of surviving 5 years, like I said, is 2% out of 100. 5 years, almost unheard of. I mean, you're likely to succumb to the treatments, not so much the cancer in 5 years. Doesn't mean that doctors don't have your best interest at heart and they're not trying to give you the best of care. It's just the only thing that they know because that's what they're taught. I have a curious nature. I never stop learning. I dig as much as I can, and since we have access to the internet, you can go anywhere and find information. You have to be careful. You have to realize that there are people out there that share information that is not truthful, or they gather information haphazardly and share it with you and give you hope that this is the one and only fantastic thing out there. And for some it may be, but it's not for everybody. I just would like to tell you, number one, that you're not alone. And number two, trust yourself, trust your gut, trust your instincts. Don't let somebody rush you into a decision that you're not comfortable with. My husband was diagnosed in November, and we were sent home, and he was given hormone blocking shots, and that was all at that time. They wanted to make sure those would work, and let me just say, my husband is not a good candidate for hormone blocker. It failed him. His testosterone was extremely high, and while it knocked his PSA down some, it started climbing again. So it really didn't do him any good to be on that shot, and as a matter of fact, he lost all of his muscle tone. There is no sex drive. Um, they are tired all the time on that drug, and it's just hard to watch someone you love go through that when they are so vibrant and they just love life. Um, in December, we noticed that one of his legs was white, the other one was pink and normal colored. His leg was going numb, his foot was going numb, and it was burning, and it was just very uncomfortable. We got in to see the urologist, and he immediately got Tawny in for an MRI. They checked that leg, and sure enough, the tumor had grown in his hip area, and it was pressing on the nerves and causing damage. So we immediately scheduled to have radiation treatments done through the radiation oncologist. 14 treatments, and he followed through with those. It was 14 days. It didn't take him probably 20 minutes to do the treatment every day, but he had to drive to have the treatments done, and also had to have blood work. And on top of that, he was also given shots to build your bone. And there are more than one shot. I will cover that in another video. He was taking one, it wasn't a shot, it was an IV, and it just would wear him out. It made him very sick for a few days after the shot. We did find out there was a better option for him, and I will share that with you in the future. Anyway, after the radiation therapy, Tony was doing fairly well, no more pain. He got to where he could walk without any problem. But at the first of the summer, he started having pain again in his hip area. And in the meantime, I've been digging and reading and remembered a book that Suzanne Summers wrote, and it's called Knockout. If you know someone that has cancer, if you have cancer, please pick up a copy of that book and read it. There's so much good information in there, and I know everyone sees her as the dumb blonde that played Chrissy on Three's Company, but that woman is one sharp lady. She does her homework, and you will find that she also has had breast cancer and come through and is a survivor. And she did not do the standard of care through everything. So I would encourage you to pick up that book and read it. It's kind of an eye-opener. You will look at your doctors differently. You will look at the medical institution completely differently, and you will especially look at the drug companies and the FDA differently. There is hope out there, and there is help. I don't want you to feel hopeless, and I don't want you to feel like you have no choices, because you do. You don't have to take full dose chemo. You may not need to take radiation. There may be other ways to handle it that doesn't make you sick. You don't lose your hair. You don't miss days and days and days of work. We understand how important that is. My husband is a commission-only salesman and has been for over 20 years. I will tell you that the causes of cancer, from everything we've gathered, can be from 3 different things. Number 1 is the food we choose to put in our mouth. And let me tell you, that's been an eye-opener. It's so easy to grab something through the drive-thru window and go. Don't do it. Your life depends on it. Read your labels. Read everything you can about how to eat better, how to take better care of yourself. Stress is another big cause of cancer. when you're stressed, your immune system is worn down. When your immune system is worn down, it cannot fight off the effects the stress has on your body, and your cells begin to multiply in a different way. They become mutated, and that's how cancer begins. Um, you have to be so careful with stress and diet. Um, and your immune system is a part of that. You have to stay healthy. You have to stay strong. That means drinking lots of good, healthy water. It means taking vitamins. It means juicing. It means a lot of things. These three things are so important. Also, I would tell you need to stay away from sugar. Anything that, not just sugar, not just cookies, but anything that turns to sugar. Corn turns to sugar. Carrots turns to sugar. Potatoes turn to sugar. Biscuits. Those things are no-nos. You have to be very, very careful with your diet. The first thing we did was put Tawny on a ketogenic diet. And that is basically just that. Nothing that turns to sugar. Lean, grass-fed, protein, no, that's not been treated with hormones or antibiotics. Grass-fed beef, free-range chicken, turkey, anything that you can find like that. Also, I just feel like juicing is very, very important. And then there are also many supplements that are important. I'm not the one necessarily to give you the supplements that you need, but I'm here to tell you that there are doctors that can do tests called a chemosensitivity test, and you think that you've never heard of that. Well, you can't go to your doctor, your standard doctor, and say, I'd like to have a chemosensitivity test. They're going to laugh at you. Chemosensitivity test, they draw your blood and they send it to Italy, and the labs there take your live blood cells and they test them against every chemo, every supplement, every known item that can fight cancer. And then they test it against your personal cancer cells in your blood, your live cancer cells. And you get back a report that shows exactly what chemo you need for your brand of cancer, exactly what chemo will fight it, exactly what supplements that will help fight your brand of cancer. You don't have to go to a doctor and them say, well, this chemo is what we use on people with prostate cancer, so we're just going to grab this off the shelf and this is what we're going to use. So many people do that and they find out that the chemo didn't work because it doesn't have any effect on their brand of cancer. A chemosensitivity test is very simple. It's just a blood test, and then it's sent out of our country into Italy. You have to find a doctor that does that. There are very few here in the United States that do. The ones that do are the ones that have their eyes wide open and they see that there are better ways to help you than make you deathly ill. After you get the chemosensitivity test, it takes about 2 weeks to get the results. Your doctor sends you a report that shows you exactly what will work for your chemo, or for your cancer, I'm sorry. And it's comforting to know that you have the ability to fight. And they don't just pick any of them. They pick the ones that have at least an 80% kill ratio. So you know that you're getting the exact best treatment. And I say your brand of cancer because I don't want to own it. I don't want to claim it. And I don't know anybody that does want to own or claim cancer. I'm a Christian, and so is my husband. We believe in the Lord Jesus Christ with all of our heart. And we know that true healing only comes from Him. I feel like He's led us to the doctors that we have found. And I'm so grateful that we had other options besides what we have here locally. Not that these doctors aren't good doctors. We have good doctors here that work with the doctors out of state that we use. But in medical school, they're taught how to use the drugs that are available from the pharmaceutical companies. And the pharmaceutical companies aren't going to mess with supplements because they can't make any money off of them. Yes, they do have chemo and they do have medicines that you may very well need. And you want them there when you need them. But it shouldn't be the only answer, the only option. After I read through the book. I read Suzanne puts at least 5 or 6 doctors in that book, maybe more. She interviews them and asks them questions, so it really gives you insight into how that doctor thinks and what methods they choose to treat you. We found a doctor that we were really pleased with in Nevada. I felt like he was the perfect doctor for my husband. He had dealt with prostate cancer and had talked about it specifically in her book. So I handed my husband the book. He's good at letting me just handle everything. And I told him, this is your body, it's your decision. You read and you tell me which doctor you think would be best. And sure enough, he picked the same 2 doctors that I was looking at. And we ended up using the same doctor. And I'm so thankful we did. From there, it was a trip to Reno to do the chemosensitivity test and meet with a doctor. It was then a trip back home, and we waited till we got the results. We found out exactly what he needed. They sent us a treatment plan immediately and worked with us to start implementing that plan by, number one, getting us on supplements that we needed until we could get there. I will tell you that they don't use insurances there. And that's okay. You think that you can't do anything without insurance. Well, let me tell you, with everything that's going on in this world, with the mess they've turned our medical coverage in, I mean, it's almost pointless right now anyway. You find that if you've had medical insurance prior and you got kicked off of your plan, well, now you can't even get on a plan without it costing you an arm and a leg because you already have a disease that they know is going to be very expensive to treat. So, you're kind of darned if you have it and darned if you don't. We went to Give Forward and started a fundraising page for my husband. We're able to raise about half of what we needed. And then we were so blessed. His brother-in-law came to him and said, we have this. We want to take care of your treatment, and you pay us back when you can. So that's what we did. Tawny was really hurting, and it was down to, we just had to get him there and start treatment because he was not doing well. So, thanks to his brother, Tawny flew out there with his brother, actually, who stayed with him for 2 weeks, and just helped him get used to the routine and made sure he was okay. I'm so thankful to him for that. Can never repay him for the time that he spent there, and I know Tawny especially loves his brother for that. It was a 3-week stay. In that time, they built up his immune system with tons of vitamins and supplements, alkaline water, and then also he did chemo treatments. But the chemo treatments were not your standard chemo. It's not full dose chemo. It's low dose, and it's done. It's called insulin potentiated therapy. When you go in, you would do a day of supplements. Then you would do a day of chemo, then you would do a day of hydrogen peroxide, then a day of chemo, and a day of supplements again, and then you were off on the weekends. He really did pretty good. He didn't feel so great the first few days, but it wasn't bad. He never threw up. He had chills. He was tired for the first few days, but by the time I got there, on the 3rd week, he was so much stronger. He wasn't as tired, and you could tell he felt better. And the support you get while you're there, I have never once heard anyone in that clinic say anything negative, you know there's negatives there. You know that not everybody lives to be 100. You know that there are some that may not make it. There are some that come so late there is no hope. I can't say there's no hope because there's always hope, but maybe there's just been too much damage done. I'm so thankful for these people. They have no idea um, what they've meant to Tawny and to me and to his whole family, everyone that loves him. They work as a team, uh, from the nurses to the girls at the front desk, the ladies in the back that handle the paperwork. I will tell you that it is considered out of network, so you may have some of your chemo taken care of and covered. The insulin potentiated therapy, they give you insulin to lower your blood sugar, and then as your blood sugar lowers to a point that they're comfortable with, then they have you start eating a sandwich and drinking some orange juice. And at that time, they start letting the chemo go in by IV. It is kind of like a Trojan horse. I told you that sugar feeds the cancer. Well, your cells have been cut off, cancer cells have been cut off from sugar because they've lowered your blood sugar. And now suddenly they see sugar coming. They thought they were going to starve to death. They see sugar coming, and so they just gobble it up. But what they don't realize is they're gobbling up the chemo, along with what little sugar you're putting back in your body. So the chemo works so much better than just standard chemo, even with full dose chemo. And we found out while my husband was down there that he cannot handle full dose chemo. Just even the low dose chemo, he had to have shots to boost his blood. So I'm thankful because here, if they had given him full dose chemo, he probably wouldn't be here today. He wouldn't have made it, past the 6-month mark. He's actually outside right now working on his tractor while I'm doing this. Won't surprise me if he shows up in here in a minute. But he's doing very well. He did have to go back in July, or not, he came back in August, had to go back in December and have just 4 more treatments of chemo. His tumor was beginning to grow in his hip, in his other hip, and it became a risk for fall, and he could bleed out. So we couldn't afford for him to fracture. So he's off right now recovering from that and letting his tumor shrink and his bone grow back over, so it can be stronger, so he can go back to work and I can have my life back. Anyway, there's so much more I want to share in detail with you. I just want you to know that you aren't alone and that there are other ways to get treatment, and there is help out there, and there are people that give you hope and encouragement, and you need something to fight for. You need something to live for. Just love each other and enjoy your time, and keep searching. Don't give up. You're always welcome to contact me through my email. And shortly, I hope to have a blog up so that I can answer questions and help people that have any questions about the doctor we chose to use in the clinic. I don't know that much about the other doctors because we decided to go with this one, but I can share a lot with you about this specific doctor and clinic. Thank you for your time, and I hope to post another video soon.